Hey guys, this is Curtis Alexander. I'm a pharmacist. In today's video, what I want to talk about is Omeprazole, also known as Prilosec. It's available over the counter. It's available as prescription. Very popular medication. So I want to hop right into it, okay? So first things first, if you're using Prilosec, what are we using it for? Well, you're primarily using it to treat GERD, or Gastroesophageal Reflux Disease. Basically, you have stomach acid that's getting past, as your lower esophagus comes down to meet your stomach, there is a sphincter or a valve there, and it's getting past that. People get heartburn and they start getting the typical symptoms of reflux and heartburn. There are differences between heartburn and reflux technically. I don't want to get into those, so we're going to kind of lump them into the same category. But that's why we're using, or that you're considering using, Omeprazole. The reason I point that out is because while Prilosec does help with it, you really need to take a step back and go, what are some of the root causes that are leading to the esophageal, the reflux problems? So we're going to come back to that a little later in the video. But first things first, so we have Prilosec can treat GERD, it can treat heartburn, it can also treat what's called H. pylori, Helicobacter pylori, which is a bacteria that people believe can lead to ulcerations in the stomach. So you don't give just Prilosec for H. pylori, you give it in combination with some other medications, including some antibiotics. So that's the main uses behind it. Next, we have the dosing. Prilosec is available in a 10, 20, 40 milligram capsule. Not all those are available over the counter. It is available in suspensions and some other forms, but primarily when people take it, we're looking at them taking the capsule formulation. Okay, so how about the dosing? It depends on how many episodes you're getting per week of the GERD. So if you're getting less than 2 per week, your doctor will most likely start you out on 10 milligrams a day, which is a very low dose. It can be increased up to 20 milligrams a day after 4 to 8 weeks. We really want to try and start you when you're taking it, give it 4 to 8 weeks, then adjust the dose. And then if you're on that dose, as you can see, after 4 to 8 weeks, if your doctor does increase you to the 20 milligrams, if you don't get any symptoms, that's what the SX is. If you don't get any symptoms after 8 weeks, you can most likely stop that. Now, if you're getting more than 2 episodes per week, what we're probably going to be looking at is a dose of 20 to 40 milligrams a day. We're also going to do that for 8 weeks. Now, we're seeing this 8-week thing mentioned here a lot. Ideally, and this doesn't happen a lot, ideally we don't want people taking Prilosec long term, and there's very good reasons for that. And when we start getting into the side effects, I'll explain that. But ideally we want you doing this on a short-term basis. So keep that in mind as you're using it. Okay, so let's talk about the side effects. Ironically, the most problematic, the most common side effect is actually respiratory infection. Now, why would a drug that's used to treat acid in your stomach essentially cause respiratory infections? So think about it this way. We already described that you have stomach acid in your stomach, obviously. That's designed to operate at a very low pH, meaning it's very acidic. Well, Prilosec comes in, and what it does is it blocks a pump called the sodium or the potassium hydrogen pump, where potassium comes in and hydrogen comes out, and that's where we get the stomach acid production from. Prilosec essentially blocks this. So the stomach acid, the pH in your stomach actually goes up, it becomes more alkaline. When that happens, your body recognizes that, in that valve, that sphincter where the esophageal, where your esophagus meets, the esophagus meets the stomach, recognizes that and becomes more relaxed because it's not as acidic, which allows food, the things that you eat to actually get up there, and you can aspirate that into your lungs. So we can get some of these very small food particles, those sorts of things into the lungs. You can get respiratory infections. That's essentially what's going on. So that's also why ideally you want to be using Prilosec on a short-term basis. Okay, so that's where we're getting the respiratory infections. The other common things, honestly, Prilosec is really well tolerated outside of the respiratory infections. Headache at 7%, abdominal pain 5%, fairly marginal side effect profile, so it's pretty good, but it's important to understand that's why I would recommend you stay on it short term, because the risk of respiratory infection is there, okay? Let's talk about drug interactions, because there are some important ones. The primary one where you just flat out don't recommend them being used together is a drug called Plavix. It's also known by the generic name clopidogrel. And the reason you don't want to use those together is because omeprazole is decreasing the stomach acid, we tend to get low levels of Plavix in the blood. And Plavix, again, is used as a blood thinner, basically. So that's something we don't want to be messing with. So manufacturer recommends that they do not use Prilosec and Plavix together. If you're still having those stomach issues, the acid reflux, we can look at using Protonix. Protonix, same class as omeprazole, but it has less of an interaction with the Plavix, okay? Next thing we need to think about, again, we're having a broad effect on the body by trying to hinder the production of stomach acid. And one of those things is when you take other medications, they're designed, a lot of them, to start to be broke down in your stomach. Well, when you have less stomach acid, some of them aren't broke down. So my recommendation is anytime you look at using something like Prilosec, have your local pharmacist run an interaction check just to double check on things that are going on, because with the changes in stomach acid, we can see changes in the amounts of medication that you're actually absorbing in your system. Next, the other one is rifampin. Not a very common medication, but if you're on it, you want to watch that, because it actually induces or causes this enzyme, which is in your liver. It will break down the Prilosec or the omeprazole faster, because rifampin is inducing that enzyme. It's making it work even harder, so it will metabolize omeprazole more, and we're going to see omeprazole levels go down. Okay, so that's kind of our overview. We talked about the uses, we talked about how it worked, we talked about the interactions, those sorts of things. So what I want to give you is my basic takeaway as a pharmacist with Prilosec. The point for me is it's okay to take Prilosec, but I think it should be on a very short-term basis. My opinion is that I would encourage you to look at, you're getting reflux for a reason. Usually it's the food you're eating. Usually it's your lifestyle. Usually weight comes into play. So it's a combination of those three things that you have to look at first. Because if you have to rely on Prilosec to stop the reflux, that's going to cause other problems down the road that we're going to be concerned about. Okay, so that's my basic takeaway. Short-term use only, keep it under 8 weeks if at all possible. Look at your diet, look at your lifestyle, look at your weight. Those can all be contributing to it. So that's my spiel on omeprazole. Any questions, put them in the comments. I do my best to answer. I am busy, so I read them all. I can't promise that I'll respond to everyone. If you have another video topic that you'd like me to cover, put it in the comments. That's a great way for me to see them. Also check out my website, curtis-alexander.com. I have a free 30 days to health report. So if you're tired, you want to get outside of the drugs and surgery as your only two options, check it out. It's free. I'll send that to you. So I hope this was helpful. Subscribe, thumbs up. Also check out the website. Thanks again.